He has been instrumental in helping my institution to grow to the present status of PG Institute. And he and other directors of various cancer centers helped Malabar Cancer Centers to reach this level. So I thank him for inviting me over here and giving his place to inaugurate this. Thanks, sir. My interest with palliative care really started when I was doing my residency in Cancer Institute Adaya. That time only we started palliative care. And the palliative care at the time, it's just mainly the pain management, some psychosocial support. But now in Adayar, we have very good palliative care center which has come up very well, and with a psycho-oncologist and physicians. And so the palliative care is actually, it's a teamwork. It's a big teamwork. It involves a lot of people. But bringing an integrative part, that is bringing in other systems into palliative care, is a very excellent idea, and it's a very novel idea. And always, whenever we plan of integrative medicine, it is often a non-starter or a doubtful starter because of various reasons. But palliative care is the best place where we can bring in all these different disciplines together, and so that we can bring in the best to our patients. And I know about Vandoor. I know my colleague is there, and he has been doing an excellent job in Vandoor Homeo College, and we used to have certain interactions with him. And in Ayurveda, I've seen there is excellent remedies for some of the things which modern medicine cannot offer. And other specialities also, they have their own strengths. But unfortunately, we do not have much of an interaction to see how we can use these strengths of various medical specialties or medical disciplines to bring together, so that we can bring in the best to the patients. And recently, our governing body, chaired by the Honorable CM, agreed to start an integrative oncology center in Malabar Cancer Center. So we are planning to bring in Ayurveda and yoga together initially. Then probably I will come to the Government Homeo Medical College for further discussions on that. And when you're bringing various Ayush departments and modern medicine to integrate, one of the major challenges what we found is that we don't understand the systems. For example, when I thought, no, it is easy to integrate with Ayurveda, so in 2009-10, I had a discussion with the Kottagal Ayurveda College, and we had an MOU, and we started a clinical study. We thought, okay, we'll start with a clinical study on, pilot study on certain rasayana which can be given for reducing the morbidity of radiation, especially mucositis. The problem happened is that then only I came to know Ayurveda is individualized. For each individual, that the combinations might change. That is one of the, because in modern medicine it is not like that. If I had to give methotrexate, for all patients will receive methotrexate. Here, some patients might something, or additionally some other things. So the standardization was one of the problem. Another problem we find that in cancer patients, when you do such studies, the compliance was poor. So this is again challenge it was. It was another big challenge. So what happened, I think we recruited around 10 was our number, but we recruit only 7. When you look at the compliance, only 2 patients have taken the medicine. The other did not take that. So then we got stuck there. So then it is the main thing what we understood. We didn't understand Ayurveda well. That is one. So unless until we know other specialities, then only we can think of. Today morning I had an excellent discussion with one of your faculty. So he was talking about homeo, how it works. And to be frank, when he was talking homeo as dilution and all those things which he was talking. So this is something we already tried in modern medicine. For example, in chemotherapy, we call this metronomic chemotherapy. In metronomic chemotherapy, what we do, instead of giving the full dose of chemotherapy, we give small doses in short intervals. Usually chemotherapy is given in cycles every 3 weeks, every 4 weeks. Here what we do, we give, for example, certain medicines. Usually we use cyclophosphamide, methotrexate, because very small doses over a small period of time. So it works. So we understand that this tumors do respond, but not respond like a full dose chemotherapy. But we use it mainly in patients who cannot take a full dose chemotherapy, who are otherwise they are not fit to undergo such chemotherapy. But this trend, it works well. Many of our patients with oral cavity cancers whom we cannot offer curative treatment, we have tried metronomic chemotherapy and tumors have disappeared. So these things are, so there are a lot of things which we have to learn from each other. I think that needs an open-mindedness. That is very, very important. So that is some areas which we'll have to look at it. Another major problems which often, I have found that the research. I think it is high time for all this, the disciplines to see that how you can bring in a clinical research and also your lab research. The basic research is how we can find out that. So that is one of the major areas we have taken up in my institution. Now we have discussed with Aushadhi and cortical about see that what are the contents, what are the chemicals in each of their products. So we want to see which chemical actually it works. This is and we have to develop a formulation for that. We had to say, okay, this is the chemical A, chemical B, chemical C, and these are the concentrations on which it is. Then I think you will get more, authenticity in when we go for certain clinical trials and clinical studies. Conducting clinical trials is another area because modern medicine has gone very well in clinical trials and clinical researches. But similarly, other specialties also they do things. But I think we have to see about because today morning some discussion about the funding support and all. Definitely, it is something as a head of an institution in Kerala. Probably these are the areas probably I can help you out to see that how we can take it forward. And palliative care, integrating other specialties and other disciplines into it is one of the best things which can happen. I just checked it. Professor Lingagoda, he said, sir, it's 5 years. I don't know what an idea it is actually. This is one of the wonderful ideas. And I come to know this Dr. Abhijit is here and Dr. Lingagoda. Naturally, I think this is not a surprise for me because we might have brought this one together. So this is the way forward for our future. And palliative care, I strongly believe palliative care has to treat as any patient in any hospital if it's coming, the palliative care should be the first thing. And after that, in our institution, we put it that way, palliative care is the umbrella under which all these departments come. So any patient who has come for, because the psycho-oncology is involved, and rehabilitation is involved, and the palliative physician is involved. So all are involved in the palliative care. So any patient is coming as a package, they have to go to psycho-oncology, they have to get physiotherapy, pain management is there, it has to be taken care, and all these things together. Similarly, in integrative thing also, I think we have to see how we can work together to bring to best for the patient. And I wish this national seminar all the best. And with your consent, I declare this is inaugurated. Thank you very much.